It creeps in silently, an invisible threat to our health and well-being. This menace doesn't announce its arrival with a bang. Instead, it seeps into our lives, unnoticed and unchallenged. It affects our daily routines, our mental state, and our physical health, often without us even realizing it. It hides in plain sight, a growing crisis affecting millions around the globe. From bustling cities to quiet rural areas, no place is immune. This crisis knows no boundaries, affecting people of all ages, races, and socioeconomic backgrounds. It's a universal issue that demands our attention and action. Obesity, often misconstrued as a simple matter of willpower, is a complex disease with far-reaching consequences. It's not just about eating too much or exercising too little. It's about genetics, environment, and a host of other factors that intertwine to create a perfect storm. The struggle with obesity is real and multifaceted, impacting not just the individual but society as a whole. This is not a judgment on appearances. It's a wake-up call about a silent epidemic slowly crippling our world. The stigma and shame associated with obesity only add to the burden, making it harder for those affected to seek help. We need to shift our perspective and understand that this is a serious health issue, not a character flaw. We are bombarded with images of idealized bodies, perpetuating unrealistic beauty standards. These images create a false narrative that thinness equals health and happiness, leading to a culture of comparison and dissatisfaction. The pressure to conform to these standards can be overwhelming, contributing to unhealthy behaviors and mental health issues. This relentless pursuit of thinness often overshadows the very real dangers lurking beneath the surface. The focus on appearance can distract us from the underlying health risks associated with obesity. It's not just about looking good, it's about feeling good and being healthy. We need to prioritize our well-being over societal expectations. Obesity is not just about how we look, it's about how we live, and more importantly, how long we live. The choices we make today can have lasting effects on our future. It's about finding a balance between healthy and unhealthy habits, and making informed decisions that support our long-term health and longevity. The extra pounds we carry can be a ticking time bomb, increasing the risk of debilitating diseases and shortening lifespans. Heart disease, diabetes, and other chronic conditions are often linked to obesity. By addressing this issue head-on, we can improve our quality of life and ensure a healthier future for generations to come. Imagine your body as a fortress designed to protect and sustain you. Now picture obesity as a relentless siege, slowly weakening your defenses and leaving you vulnerable to attack. Excess fat doesn't just sit idly, it actively disrupts your body's delicate balance, triggering a cascade of harmful effects. Your heart, forced to work harder to pump blood through a network of constricted vessels, becomes strained and damaged. Your pancreas, struggling to keep up with the demand for insulin, cries out in protest as diabetes takes hold. Even your cells, once healthy and vibrant, begin to mutate and grow uncontrollably, the insidious seeds of cancer taking root. The statistics are alarming, painting a grim picture of a world growing wider. Over 2 billion adults are overweight or obese, a staggering number that has tripled since 1975. This isn't just a problem of affluent nations, it's a global crisis affecting both developed and developing countries. Children are not spared from this epidemic, with childhood obesity rates reaching unprecedented levels. Imagine a generation growing up with an increased risk of heart disease, diabetes, and certain types of cancer. This is the reality we face if we don't act now. We are on the precipice of a public health crisis of immense proportions, one that demands our immediate attention. Behind the statistics are real people, each with their own story to tell. These stories are often hidden behind the numbers, but they are crucial to understanding the full picture of obesity. Each face represents a unique journey, filled with challenges, triumphs, and everyday struggles. The single mother struggling to put healthy food on the table, working 2 jobs to make ends meet. She juggles her responsibilities, often sacrificing her own well-being to ensure her children are cared for. Her days are long and her nights are short, filled with worry about how to provide nutritious meals on a tight budget. The young child growing up in a food desert, where fresh produce is a luxury and fast food is the norm. This child faces limited options with convenience stores and fast food chains dominating the landscape. The lack of access to healthy food options impacts their growth, health, and future. The elderly man, housebound and isolated, relying on processed meals for sustenance. His mobility is limited, and his social interactions are few. The convenience of TV dinners comes at the cost of his health, as he struggles with loneliness and the lack of fresh, nutritious food. These are the faces of obesity, often overlooked and forgotten. Each person has a story that deserves to be heard, a struggle that needs to be acknowledged. They are more than just statistics. They are individuals with hopes, dreams, and the desire for a better life. They are our neighbors, our colleagues, our friends, and our family members. Their experiences are intertwined with our own, and their well-being affects the fabric of our communities. By understanding their stories, we can begin to address the root causes of obesity and work towards meaningful solutions. Their struggles are our struggles, their pain is our pain. When we see them, we see ourselves. The emotional toll of obesity is profound, affecting mental health, self-esteem, and overall quality of life. It is a shared burden that requires collective empathy and action. It's time to move beyond judgment and extend a hand of compassion and understanding. By supporting each other, we can create a more inclusive and healthier society. Let us recognize the humanity in each face and work together to build a future where everyone has the opportunity to thrive. The impact of obesity extends far beyond the individual, casting a long shadow over our societies and economies. The healthcare costs associated with obesity-related diseases are staggering, placing an immense burden on individuals, families, and healthcare systems worldwide. But the true cost of this epidemic goes beyond dollars and cents. It's the lost productivity, the missed opportunities, the diminished quality of life. It's the emotional toll on individuals and families grappling with the physical and emotional consequences of this disease. We must recognize that obesity is not just a personal struggle, it's a societal issue that demands a collective response. The urgency of the situation cannot be overstated. We are at a crossroads, facing a future where obesity threatens to overwhelm our healthcare systems and undermine the well-being of entire generations. But there is still time to act, to reverse this tide and reclaim our health. We need a multi-pronged approach that addresses the complex root causes of obesity. This includes promoting healthy eating habits through education and access to affordable, nutritious food. It means creating environments that encourage physical activity and discourage sedentary lifestyles. And it requires addressing the social determinants of health, such as poverty and lack of access to healthcare, that contribute to the obesity epidemic. The fight against obesity is not about achieving an unrealistic ideal of thinness, it's about embracing a holistic vision of health and well-being. This means understanding that health is multifaceted, encompassing physical, mental, and emotional aspects. It's about recognizing that every individual is unique and that health can look different for everyone. It's about empowering individuals to make informed choices about their bodies and their lives. Education plays a crucial role here, providing people with the knowledge they need to make healthier decisions. From understanding nutritional labels to knowing the benefits of regular physical activity, informed choices are the foundation of a healthier life. It's about creating a world where everyone has the opportunity to live a long, healthy, and fulfilling life. This vision includes safe neighborhoods where children can play, access to parks and recreational facilities, and communities that support active lifestyles. It's about ensuring that everyone, regardless of their background, has the resources they need to thrive. This isn't just the responsibility of individuals. It requires a collective effort from governments, healthcare providers, communities, and individuals working together. Collaboration is key as it allows for the sharing of resources, knowledge, and support systems. By working together, we can create a more inclusive and supportive environment for everyone. We must demand policies that support healthy choices, invest in research and prevention programs, and create supportive environments that foster well-being. This includes advocating for better food labeling, funding for public health initiatives, and creating urban spaces that encourage physical activity. Policy changes can have a profound impact on public health, making it easier for people to make healthier choices. The time for complacency is over. The time for action is now. We can no longer afford to wait. The health of our communities depends on the steps we take today. Every moment counts, and every action, no matter how small, contributes to a larger movement towards better health. Let us rise to the challenge and reclaim our health, together. By uniting our efforts, we can create a future where health and well-being are accessible to all. Together, we can plant the seeds of change and nurture a healthier, happier world for generations to come. One wrong move, one careless moment. That's all it takes for obesity to spiral into a life-threatening condition. The risks are real, the consequences are devastating, and time is running out. Are you ready to take control of your health? Most people aren't, and the price is their life. If this made you pause, smash that like button, subscribe for life-saving tips, and share this video. It could save someone you care about. Want to know how to take charge of your health? Click the link in the description for must-have resources to protect yourself and your loved ones. And don't look away. Click now to watch the next video, where we reveal another hidden danger that you can't afford to ignore. The time to act is now.